And her neck's really tight. And she still has some muscle spasm and inflammation in her neck from the wreck. And I'm using my hands to make sure she's relaxed. And I'm about to do something called an adjustment. But this is a special adjustment. We use a handheld instrument that provides 40 hertz, an impulse device that gently lines up the vertebrae. And I'm doing a leg length analysis. And I'm going to check with my hands the pelvis. Is this or this tender when I touch here or here?
The left side.
The left side. And I'm going to go ahead and start aligning her pelvis. They're wondering how it might feel to go to a doctor of chiropractic.
It's just like vibration on your back, on your lower back.
So it doesn't hurt at all, right?
Not at all.
Because they're wondering if it might hurt to see a chiropractor, especially after an accident. Go ahead, put your head in the middle. How does this feel?
It's very tender.
So most of us have lower back pain. About 80% of us struggle with our lower backs. Gently realign the vertebrae and help the discs that lie between the backbones. And I'm feeling with my hands to see how the muscles are in the lower back. And I'm checking the hips. The hips should move in and out easily. And she has good ranges of motion, and I'm checking the muscles in her legs. And her legs have good muscle tone, but her neck's a little locked up. When I move to the left, she moves very fluidly and like she should, or normal. But when I push to the right, there's hardly any movement there at all. And I'm going to make an adjustment using the instrument to put tiny impulses into the joints of the neck. And you can see that that's much better, that her neck moves much more easily. So we can do tests right here on the table to see if the vertebrae are out of alignment or if there's restriction of motion. And I'm working on the muscles in the shoulder region, and most of us carry tension here. And I'm working to get rid of that tension, and I'm feeling with my hand where she's inflamed, where she's out of alignment. And after an accident, just about anything can be involved. And we have headaches and neck pain and numbness and tingling in our arms, hands, and fingers, and blurred vision and difficulty sleeping, mid-back pain, lower back pain. We can have knee problems. We can have trouble swallowing. We could have clicking in our jaws. We could have nausea, vomiting, blurred vision, loss of memory, loss of concentration. Our whole world can be turned upside down, but this is a nice, safe, gentle way to get the spine lined up properly and to maximize our potential for better health, particularly after accident-related injuries. Dominique, is there anything else you'd like examined in particular today? And I'm about to lift her up, and we have a special table that maintains the patient's posture so that we can analyze their posture. And I was wondering, could you tell them what you've noticed with care at our center?
Yes, great professionalism. I don't have as much neck pain as I used to have.
Yes.
We're very welcoming here.
It's been a pleasure working with you. Do we help children too here?
Absolutely, super kid friendly. So you don't have to worry about missing any appointments.
And do children have problems after accidents?
Absolutely.
And what might they suffer? What have you noticed?
Sometimes they don't show any signs, so even if they don't show any signs, it's still very important for you to bring them in and make sure everything is okay.
That's a good idea. Thank you very much for telling them about chiropractic care, especially after
Absolutely.
accidents.
Have a good one.